One of the biggest takeaways from the province's report was no mention as to how Alberta would make up the nearly $200 million worth of federal funding if a provincial police force was started. At a news conference on Friday, Alberta Justice Minister and Solicitor General Casey Medu was pressed on how his government would make up that lost money.
Taxes will not go up. As I have always said, the province of Ontario, the province of Quebec, and Newfoundland and Labrador have got their own provincial police service. And I think the time has come for the province of Alberta to do the same.
The report went on to say that if the change to a provincial police force was made, Alberta would have to fork over a whopping $366 million during a 6-year transition period.
And that's a lot of money for the provincial government to be leaving on the table for the taxpayers of Alberta to pay for. And I think the taxpayers of Alberta deserve a full and frank discussion about all the costs of policing and what exactly they would be left on the hook for.
The RCMP currently provides policing services to 47 municipalities and 22 First Nation communities in Alberta. The Mayor of Stirling, Trevor Lewington, says the village has written letters to Minister Medu on this topic, and 80% of the members of the Alberta Urban Municipalities Association have also written letters of concern as well.
The biggest concern for us, of course, is increased costs. So the report itself, the government's own document, tells us that this system would be more expensive than in creating a provincial police force to replace the RCMP. And certainly the experience of towns the size of Stirling with about 1,400 people in Ontario and Quebec mirror that experience. We're projecting in the next couple of years, we'll be paying about $65,000 a year. That'll be our contribution towards policing in our community.
The Alberta government still hasn't made a decision on whether or not they will go ahead with a provincial police force or not. For Bridge City News, I'm Micah Quinn.